Hello everyone, this is Dr. Chandana Vishwanatham. In this video, I would like to talk about Mrcp UK exam, the basics. I mean the process to apply, what are the steps, how to clear them, the eligibility and everything. So let's go into the details. Coming to the introduction, MRCP, as most of you might be knowing, that it stands for Membership of the Royal College of Physicians of the UK. So in this video, I'll be talking about the eligibility, the steps, what is the right time to take MRCP, my MRCP account, the documents that are needed, and any limit on the number of attempts or time limit and everything. And part 1, part 2 includes written and PACES exam. So I will be making a separate video on part 1 and part 2 separately, but in this video I'll be giving a brief idea on what are these exams as well. So I have started this YouTube channel because when I applied for the exam, I had many difficulties because of lack of knowledge on how to prepare, how to apply. I used to call people and ask for doubts and used to search online for resources, websites, YouTube videos, which made things difficult for me. And I used to had I used to have some friends who completed their MRCP and some of them went to UK through MTI, which is Medical Training Initiative. So I used to ask them about how to apply everything, but most of the people might not have such friends who are ready to help. So I wanted to make this video which makes things easier for people who want to pursue MRCP. Okay. Coming to the first one, eligibility. So you should have a primary medical qualification, which is MBBS, followed by at least 1 year of internship or clinical experience. After graduation, in most of the countries, MBBS is usually followed by at least 1 year of internship. So that will do the job. There is no need of any separate internship as such. Coming to the steps of MRCP, the part 1 is a written exam. Part 2 consists of both written and PACES as well. PACES is a clinical exam. So the next question is, when is the right time to give MRCP? So there are some people who suggest that part 1 should be taken with at least 12 to 24 months of clinical experience after graduation from your MBBS, and part 2 within 36 months of graduation, and PACES after 36 months of graduation. But I'm telling you that it is never too late to start your preparation. Even if you have completed your MBBS and you have done your MD in your home country, then also you can start your preparation for your MRCP, which will be an add-on degree for you and you will be eligible to work in UK. But if you are committed to this pathway anyway, it is better that you start your preparation during your internship, and once you finish your internship you can give part 1, and you can have an adequate clinical experience after that, and then you can plan your part 2 and PACES. And PACES obviously needs so much of clinical experience, so it is better if you give at least 2 years after your graduation and you have sufficient clinical exposure, because balancing adequate clinical experience with exam readiness is the key in MRCP, particularly for the PACES exam, which demands substantial clinical exposure. And one more thing is, after you give part 1, you will be eligible for PACES, but try giving part 2 before PACES, because that will make things easier for you, and by the time you prepare for part 2 you will have much more clinical experience to give PACES. So try to attempt part 2 before PACES. And my MRCP account, so this is an account that you have to create by going to this site, mymrcp.org. So in this you need to create your own MRCP account. After creating the account, the details that you have to fill in, like your name, address and everything, all the details that will be asked, you have to fill them. After that you will be allotted an RCP code once your account is verified. So this RCP code is very important, because whenever you have exams, this RCP code need to be there, and you will be asked to bubble the OMR sheets with your RCP code, which is very important in your identification uh, during these MRCP exams. So once you create your account and you have an RCP code with you, you have to go to the option of upcoming exams, which will show the dates on which the application is opening for part 1 and the closing date of application and the exam date. Everything will be there in the upcoming exam options. So there you can find part 1, part 2 paces and some of the specialty certificate examinations as well. So if you're willing to write part 1, you have to apply for part 1 in the upcoming exam section. So that is how it is. And before applying, please check the dates and apply. Make sure you don't have any other work on the day of the exam, because you will be putting a lot of money into this, lot of effort into this, and on the day of the exam, if you're not free to attend the exam and you have other responsibilities, that will be a disaster. So check the dates, see if you're free and available to take the exam on that day, only then apply. So coming to the documents that you will be needing, primary medical qualification, that is the MBBS degree, that you have to get a photocopy, which is the color Xerox or something like that. So on the photocopy, you have to get it attested, and during the creation of your account, they will be asking about the date of passing your MBBS exam. The date on which the results got published is the same date that you have to enter, and this primary medical qualification should be mailed to pmq@mrcpuk.org. This is the mail ID that you have to, after creation of the account, when you're applying for part 1, then you have to mail your PMQ to this mail ID. Okay. So the next one is attempts. There is a recent change in the RCP. The number of attempts have been limited to 6, but previously there used to be a limit on the time as well, because it will be difficult for people who are within the 7 years of limit. If you have completed your MRCP part 1 7 years back, you won't be eligible for your part 2 on paces. This is the previous rule, so that has become difficult for people who are approaching their time limit. So this time limit has been removed recently, and there is only limit on the number of attempts, that is 6 attempts for each step. So if you have passed your MRCP part 1 7 years ago, you will be eligible to write part 2 now. So this rule of 7 years is no more. So coming to MRCP part 1, the exam pattern is consists of 2 papers, 3 hours each and 100 questions each. So you will have to sit for 6 hours. You'll have a break of 1 hour in between. So it is best of 5 MCQs, and you can check for the dates and the number of diets and the dates of each diet in the federation.uk website. Usually there are 4 diets of MRCP part 1 in a year. The fees would be 460 pounds for people who are taking the exam in UK, and 616 pounds for international candidates. Like, there are many centers outside UK also. So for those international centers, it is 616 pounds. So coming to the application process, as I told you, you need to create your account in My Mrcp UK. After logging in to the account, you have to apply for the exam. Go to the upcoming exam section, and you need to apply for the desired exam, and then select the exam center. And when you're applying for part 1, at the same time you apply and then send your PMQ to the mail ID that I have mentioned before, and then do the payment. So this is the brief application process. The pass rate is usually 40 to 50%, but no need to worry about it. Uh, Try and pass part 1 in first attempt. So after applying for the exam, you will be receiving your admission document approximately 4 weeks before the exam, and you need to take that admission document with you on the day of the exam. So you'll be going to the exam center, and the first session of the exam starts. You have to sit and write for 3 hours straight, and then you'll have a break for an hour, probably an hour, and then you'll be sitting for another 3 hours. That will be an offline exam, like you'll be given an a booklet where you need to read the questions, and you will be given an OMR sheet, which you need to bubble the options with a pencil. So this is what happens on the day of the exam briefly. So this is the um format of part 1. So this includes various specialties such as cardiology, pharmacology, clinical sciences, which is very difficult one, and then dermatology, endocrinology, gastroenterology, geriatrics, hematology, infectious diseases, neurology, oncology, medical ophthalmology, palliative care, end of life care, psychiatry, renal medicine, respiratory medicine, and rheumatology. So these are the number of questions that are expected in the exam, but there could be a minor variation from the given numbers. And clinical sciences includes cell molecular membrane biology, clinical anatomy, biochemistry, physiology. So all these basic sciences will be included. And genetics, immunology, statistics, epidemiology, and evidence-based medicine as well. So this is the number of questions that are expected. Coming to Mrcp part 2, the exam pattern is similar. That is 2 papers, 3 hours each, 100 questions each. Best of 5 MCQs. So the dates and the diets, 4 per year, you can check it on the federation.uk website. The fees £460 for UK centers and £616 for international centers. And the application is in the same way. You have to log in to your MyMRCP account, apply for the exam in the upcoming exam section, and select your exam center and payment, and that will be done. You will have an confirmation mail after the application, and the pass rate is about 60%, and you'll be receiving your admission document 4 weeks before the exam, which will contain the details about your exam center and location, everything, the timing and all. So you need to take your admission document and your ID proof, preferably passport, because it will contain a signature of yours and a photo of yours as well in a single paper. So passport is preferred one. So you need to take your admission document and your ID proof to the exam hall. In the same way, the exam starts, and you will be sitting 3 hours straight with the booklet with you, question booklet, and you have to bubble the OMR sheet with pencil. And after this 3 hours, you'll have a break. You'll have a short break for 1 hour, and then you have to write second paper for 3 hours. So this is what happens in the exam. So for part 2, this is the format. These are the number of questions that are expected from each specialty. You can go through all of this in the federation.uk website. The main difference between part 1 and part 2 is not the syllabus, or is not the specialities, something like that. The main difference is the depth of knowledge that you will be tested on. Mrcp part 2 is more of a clinical reasoning or clinical judgment, whereas part 1 is a fact-based questions and the memory-based questions will be tested. So part 2, it also includes some of the extra things such as clinical photographs, pathology slides, inheritance trees, ECGs, X-rays, CT, MRI scans, echocardiographs. So all these won't be there in part 1. These are included only in part 2. So the depth of the knowledge that you are being tested on will be very much, the difference is very clear. Like when you give the exam, you will understand. When you prepare for part 2, you will understand the difference. The way they frame the MCQs is also very different from part 1. So maybe the syllabus is same. Most of them think that it is very easy to pass part 2, but apart from the syllabus, there are many things that make part 2 harder to pass. So don't think in that way. I agree that the syllabus is same, but you need to prepare very much harder for part 2 compared to part 1. And the biggest hurdle in MRCP is PACES, which is a clinical exam. So there are 3 dates happening per year. You can check the dates in the federation.uk website, and the fees is £657 for UK centers and £1278 for international centers. In the same way, you have to log into your account, go to the upcoming exam section, apply for the exam, select exam center. Here you will be for international centers. You can select 4 exam centers nearby. For example, I'm from Hyderabad, so I have selected nearby exam centers as well. Like I've selected Hyderabad, Bangalore, Kolkata, and Pune. So in the similar way, you will be asked to select 4 exam centers because the centers will be allocated based on the demand. So after selecting the exam centers, if you are a person applying from the UK or for the UK center, you will be asked to, for PACES there will be a difference if you're applying from UK or if you're applying from if you're applying for an international center. If you're applying from UK or applying for UK centers, you will be asked to do the payment. But if you're applying for international centers, after you apply for the exam, you will receive a mail that if the application is successful, only after a successful application you will do the payment. So that is the difference. And pass rate of PACES is about 60%, but you need not worry about it. As I told you previously, if you are confident enough to give PACES, and if you are having good clinical exposure and good amount of preparation, will help you pass easily. That 60% doesn't make any difference for you. And PACES carousel is something you have to thoroughly study before starting the preparation for PACES, because it is the format in which the exam will be conducted. So the admission document, same 4 weeks before the exam, you'll get the admission document in your mail ID. And on the day of the exam, what happens is these are the 5 stations that you will be passing through. So station 1, communication station and respiratory examination, and then consultation station 20 minutes, and cardiovascular system examination, neurologic examination, communication station, abdomen examination, and then consultation. So these are the 5 stations that you will be rotating. After the 5 stations are completed, then the exam will be done. So these are the patient encounters. As I told you, station 1, 2, 3, 4, 5. Total is 125 minutes, which includes 5 minutes break in between each station. But the marking of this PACES examination is not based on these stations, but the clinical skill that you perform in those stations is important, because there are 7 clinical skills you will be tested upon. The first one is physical examination, identifying physical signs, clinical communication, making a differential diagnosis, clinical judgment, managing patient concerns, and managing patient welfare. So these are labeled as A, B, C, D, E, F, G. So in Station 1, communication. You will be tested for C, E, F, G skills. So similarly, uh, this is a table which is showing the station, that is the patient encounter, and the skills that are assessed in the particular station. So on each skill, you will be graded as satisfactory 2 marks, borderline 1 mark, unsatisfactory 0 marks. So you need to pass each skill separately. So even if you have not performed one of the stations properly, it doesn't mean that you will fail. If your clinical skills, the 7 clinical skills, if you have passed, you will pass the exam. So for part 1, the pass mark is 540, part 2 it is 454, and the scores are scaled from 200 to 800 by the process of equating. It means that each question need not have a similar mark, so but you don't have to worry about it. In the 200 questions, if you are able to answer about 140 to 150 at least, it will be better and it will be easier for you to pass the exam. In PACES, you need to pass the individual skill separately. I'll show you an example. So when you pass your PACES exam, this is the result report. So as you can see here, the encounters and the total available marks for each encounter is given. After that, the skills, the 7 skills like physical examination, physical science, communication, differential diagnosis, judgment, patient concerns, patient welfare, each of them have a separate mark. So the total score is 168. You need to at least get 126 marks, and that too. So when you see this physical examination, the total available is 24, pass mark is 16. So identifying physical science, total available is 24, the pass mark is 14. Clinical communication, the total available is 16, pass mark is 11. So in this manner, you have to pass each individual skill. Even if you fail to perform well in 1 or 2 stations, it is nothing like you will fail or something. You can pass the exam by meeting the pass mark of each individual skill. So best of luck for the exam, guys. This is a very prestigious exam, and if you want to sit for the exam, I really wish best of luck for you. And any doubts that you have, you can comment down below in the comment section. And please subscribe to the channel, because I will be making videos regularly and posting them, which is mainly regarding the Mrcp. Mainly the theory part I will be dealing with the videos, and clinicals maybe I will be starting it soon. As of now, I will be making videos on part 1 and part 2, and I will make your preparation easy. So please subscribe to my channel. Thank you.